So what do you feel, Annie, is expected of you for this placement?
Well, I feel like there's a range of things that are expected. So consistent professionalism is one, and attentiveness and enthusiasm, and trying to take advantage of whatever opportunities are presented to you.
That's perfect. You've just mentioned the 4 domains, which is what you'll be assessed on, and it's expected that you perform well in each of these domains.
Mm-hmm.
So professionally, I can see you've been punctual, you're dressed well today. You've come with your objectives,
Yeah.
which is great because you've got a nice clear goal of what your aim is for this placement. And I'll go through these objectives and get them back to you in a few days.
Okay, thanks.
We'll discuss them.
Yeah, cool.
So there's also for critical thinking.
Mm-hmm.
What sort of things do you think you'll be expected to show for that?
So I guess going beyond, the task in front of you, try not to be too task oriented, and linking why you're doing what you're doing with the patient and how they're presenting. Yeah, trying to kind of think and link between the pathophysiology and the actual presentation of the patient, so as not to kind of miss things.
That's good. So you've got your transferable knowledge you've learned at uni, so it's important to do some pre-reading on this specialty area so you can link your theory to this clinical context. You'll also be doing critical reflection. So I know you've gone through the 5 R's at uni, and that's basically to develop yourself whilst you're on placement.
I think reflection is really important to kind of improve practice and realise that you can't be perfect in anything you do.
Yeah.
So
And so for patient safety, you'll be consolidating your skills, interpreting them based on the patients.
Yeah.
And you'll start to identify the different roles in the healthcare team.
Yeah.
Work out how they fit in.
Yeah.
And you'll always need to be aware of your scope of practice.
Yeah.
So how do you feel about that?
Well, I think that's something I do kind of find a bit difficult on prac sometimes, when you're trying not to be a burden to your buddy nurse or whoever, and when there's things that seem so simple but you just have to say no to stay within your scope of practice. It's sometimes quite difficult to be an advocate for yourself.
I think a tip for that, to help you with that, is to have a sentence prepared in your mind.
Yeah,
so that you've got something you can say, look, that's not in my scope, but I can get my facilitator. Something pre-prepared, so then you don't get those nerves around saying no to your nurse.
That's a good idea. Okay.
And I think you'll be fine with that if you've got that sentence prepared.
Okay, no, thank you. That sounds good.
And so communication, you're communicating really well with me this afternoon. It's important to start increasing your awareness of your body language, because communication's 90% non-verbal.
Yeah.
So it's great how you're showing your enthuse with your leaning forward and eye contact, and if you keep doing that, you'll be fine on placement.
Thank you.
The last thing is the documentation. So have you been to this hospital before?
Not this one, no.
That's fine, because all documentation has the same principles.
Okay.
It's just to be accurate, concise and objective all the time. Cool. So once you're familiar with the documentation of where to place everything this afternoon, if you've got those principles, you'll be fine with that.
Okay, good. Yeah.
Have you got any other questions about any of this?
Not yet, but I think I will.
Okay, no worries.
Yes.
So that's great. We've gone through the main points of your expectations. If you've got any questions, you can always come and talk to me, but we'll be meeting regularly through this placement.
Okay, thank you.
No worries.